Hello, I'm Dr. Alexandre Amato, vascular surgeon at the Amato Institute, and today I'm going to talk again about a topic that interests me a lot, which is lipedema. I'll discuss the surgical treatment. Is the surgical treatment for lipedema the definitive solution? Problem solved then? No more lipedema after liposuction, after lipedema surgery? Let's talk about it. Subscribe to our channel, take a moment now, click the bell below too. We keep making videos exactly because you are subscribing. So let's talk about the surgery. Lipedema is a genetic disease. I've mentioned this several times here on the channel. In other words, you are born with this gene, and to date there is no genetic treatment that is effective. There are indeed several studies on gene modification, but it's not yet applicable in clinical practice. And lipedema still hasn't been identified, which gene it is exactly that is causing the problem. And this genetic disease will have a change. It will express itself after a hormonal change. So many women carry the gene and don't express the disease, and there are others who express the disease earlier, others more late. So let's go a surgery, which is a very specific liposuction, a liposuction where we have to preserve the lymphatic system, the vascular lymphatic system. But essentially what will it do? It will remove this fat deposited, this diseased fat in the lower limbs. Removing this diseased fat will change the genetics? No, it won't change the genetics. So the surgery is unable to definitively treat lipedema. What it will do, yes, and this is the main goal, is to improve mobility, to improve symptoms. Those are the main goals. Secondarily or even tertiarily, it can bring an aesthetic benefit, but this cannot come before the improvement and preservation of mobility and symptomatology. So, when we perform a surgical treatment, and the idea is that the patient remains well for a long time, but for that to happen, it's necessary to have and to undergo clinical treatment. The clinical treatment will teach the patient how to control this disease, how to reduce inflammation, and how to prevent progression. Yeah, you see, it's already described in several scientific studies, adipogenesis. Adipogenesis is the formation of new fat cells, deposited by this alteration and inflammation in the lymphatic system. So after fat is removed, it can come back. In a way, it's more common when we think of liposuction in another area, or fat that isn't from lipedema. It doesn't usually come back. Even the cells can grow back. But when we talk about lipedema, the entire pathogenesis of the disease is different. So this fat deposition can happen again because of the inflammation. So I've seen some patients who come here after a liposuction done in the past, often without even knowing they had lipedema, and who came back with all the symptoms. Since they improved at the time with the liposuction, they believe that liposuction is the only treatment for lipedema, and it is not. Mainly in these cases, it's important to raise awareness, to understand that there is a clinical treatment for each goal. The goal could be symptom improvement, it could be volumetric reduction of the limbs, it could be mobility improvement, or it could be improvement of some comorbidity. So sometimes we treat lipedema thinking about improving symptoms associated with another disease that is also present. So clinical treatment is necessary for all lipedema patients, and unfortunately surgical treatment is not a definitive treatment. It is, yes, a great hope. It is, yes, a great chance for improvement, but we can't consider it as that silver bullet that will solve every problem related to lipedema, because it won't. So it is very important that all patients who wish to undergo liposuction first become aware of the clinical treatment available, but not just that. They should also carefully consider the timing of this surgery, because once the surgery is done and there's no turning back, so it can turn out well, which is what we hope for, what we strive for, what we try to achieve for everyone, but there are other limitations associated with surgery that need to be understood. And another aspect is the synchronization of what the patient wants with what the doctor has to offer. So the aesthetic pursuit, serum is sometimes the priority, while the doctor is aiming for the best mobility and symptom reduction. So there needs to be a synchronization of what the patient wants, what the patient's goal is, with the goal of the doctor. So the surgical treatment is there to help as an additional tool in the treatment of patients with lipedema. Don't forget to talk to a specialist on the subject about all the possibilities that are on the table, and avoid, if possible, having the surgery during an inflammatory crisis. In that moment of worst pain, in that moment of worst symptoms, the ideal is to treat clinically, reach your best clinical stage, your best clinical situation, and then make a conscious decision. At that moment, you won't be coerced by pain into making a surgical decision. It will be your decision, and a decision made with information and awareness. Did you like our video? Subscribe to our channel, click the bell below, share with your friends, and see you next time.